Dr. Rattel, do you have any numbers on recovery rates?
So every day we report on recovery. I'm sorry, repeat the question again. I'm still not trainable, apparently. Can I give some information on recovery rates? Every day we do report on the recovery, and today we're reporting 248 recoveries as part of the daily report. And as I remind people, that's related to the fact that we go back and interview back out to make sure that individuals who were symptomatic or were hospitalized have fully recovered. And so that isn't always a magic timeline date. It is based on the patient's signs and symptoms and their closure.
A couple questions from our viewers. Do you have a percentage of the number of cases that require hospitalization?
We are currently going through that, and we talked about that. Was the question again is, do I have data on hospitalization rate? And we talked about this, I think about a week ago, and we're going to try and do a kind of mid-month report that does a summary on this. At that time, 11% of our patients who had tested positive required some form of hospitalization.
Do you still anticipate, you said that the new cases jumped a lot because of the backlog of tests. Do you anticipate, are those numbers going to keep jumping as a result of those backlog of tests, or have we caught up?
Well, again, we're doing a reconciliation with the state. The question was, do I expect the positivity rate to increase number of cases? And when we reflect back, we said we would take, there were two testing sites that use this particular lab, one in Aurora and one in Rockford. So we were getting all of those results. And again, we're reconciling against what we call the manifest, which is the list of tests that were submitted out of the Rockford site. So we don't expect the positivity rate to change significantly, which is why we report that every day. And we're also going back, as time goes on, it's not just number of positive cases per day or positivity rate, is to look at the date of illness onset, right, as well, because that's part of that interviewing process. And if someone, I've gotten the question, if someone does not have any symptoms, what is that date? And that's the date of the test. So we will be adjusting that as well. You'll start seeing some of that reflect a little bit more of a curve as we go through that and get those dates from the individuals after they're interviewed.
Dr. Martel, how far could you go back? I'm sorry, could you go back over? There's about 2,100 tests, right, that were delayed. You're working through. You've gotten all those results back. Is that correct?
Right now, and again, let me repeat the question. I'm getting hand signals back there. Is, am I confident of 2,100 tests? Have I gotten all those back? Well, remember, I'm getting a flood of tests from 2 sites now. So when we report out our numbers, that's because we've gone through and highlighted individuals who have an address in Winnebago County. So included in all those test results, part of the information coming back the way that we could get it, I get everyone who tested through that site regardless of their county of residence. So I have to go back and make sure that I've also matched up on those. So every day we do some reconciliation, making sure, matching them, did we get the test result for all of the individuals from our community? We have not gotten all test results back at this time, but they are working. Every day we're getting more through the system.
So what is that 2,100 number?
That is, every day at that test site, a manifest is generated. A manifest is simply a listing of the tests that were submitted by patient name, date of birth, address. And at the end of every day, from that site, we would go through in order to provide information for our community, we would highlight manually, because it's on a sheet. It's not on a spreadsheet that we can sort. It's on a, basically a filled out form, and we would highlight and count those residents who had an address in Winnebago County. So that's how we would get to the number that were tested just for our county.
And that's that number?
That's the 2,100 that we estimated, right?
From a certain time.
From,
okay. I guess I'm trying to get at. So now you contacted 1,500 of those, right? It was about 1,500 of the results. And so
it's not a simple addition because I'm getting results. As I said, I accepted results for every test in the area. So we are contacting anyone, regardless of where they were tested. As those results come in every day, We are contacting every single one of them and notifying the test result. We see people whose addresses are in DuPage County, Kane County, Cook County, Wisconsin, Indiana. We are definitely putting Winnebago and Rockford on the map.
So we're getting through the list, but it's hard to tell how far we are.
And every night we go back through to take and see where we're at. We know that we've gotten earlier dates, and we're working through this. It is a manual process, and I really appreciate the patience. And if anyone, again, we are still getting requests from the hotline. We match those up. We go back through. We start to look to see, do we have those somewhere in the list? But we are working every day with the state of Illinois, at least twice a day, to try and get those results out. And because as the lab results them from that site, then they're putting them into a file that gets sent over to us.
Dr. Martell, James Stratton here from 13 WREX. I hope I'm not interrupting anyone in the room. I can't quite hear them. An unreleased White House coronavirus task force report shows Rockford in the top 10 in week-over-week cases in our country. It puts us at 9th in the country, 83% week-over-week in that report done by the White House. Can you respond to that and potentially why that is?
The question was regarding the White House report and looking like we're week over week. Well, it's that influx of test results that we have coming in. When you look back, and that's why I said the date of the onset of symptoms is really the more accurate reporting, but we can't enter that until we've interviewed the client when we call with their results to find out whether they were symptomatic, if they're a positive test result, or whether they were asymptomatic, and enter that back. So there is an inflation on that number based on those, backlog of tests.
So more testing equals an increase of cases week over week?
It would look like that, right? Because we got 200 results, we got another 120 today. It would seem that we have an exponential increase. But when we looked at that, 56% of those were represented by those backlog of test results.
Okay, a follow-up question to that would be, should we open for phase 3 if we are considered a hotspot and Washington, D.C. basically is watching us?
Well, first of all, to repeat the question again is, should we be concerned and should we be planning for phase 3, reopening if we're a hotspot? Well, first of all, I think we've talked from the last month about coexisting with COVID. And we are not going to completely eradicate this disease until we have an effective treatment, a vaccine, and even then, we know we have vaccine-preventable diseases that crop up. So we have to be thoughtful about this. That is why a full-out all-open creates a potential for us to have further cases and spikes. So that's why it's important, as we work through this in the phased recovery plan, along with the state of Illinois and our region, is to work to how do we begin that process of opening up safely, and I think really from the standpoint of sustainability, I call it in a way of with confidence. As a consumer, am I confident to go in the store that I'm not going to have an issue or be exposed, or the restaurant? If I'm the business owner, am I confident that I'm able to maintain safe practices for my employees and my customers coming in, so that it really is a mutual agreement and understanding how we're going to have to adapt our business practices, our service practices, to be able to coexist for that time frame. You heard last week about, and we started elective procedures this week, and one of the ideas is that you have to be tested before you can have your surgical procedure done. So as they roll back out, for restaurants, what does that look like? For child care facilities, what is that going to look like? But the concept that we can simply just open everything when we know we have disease circulating in the community, we have communities of concern, it becomes very, I'm going to say, almost irresponsible at that point. We need to move forward in a way that allows us to make sure that we can address any outbreaks that were to occur, that we promptly identify individuals either in the workforce or customers or exposures, so that we can promptly isolate them and test them and be able to then continue to move forward. We don't want to have to ramp back suddenly. That is as disruptive to anybody and any business, any service, is if we have to suddenly close it down as well again, as we know from having to take very extreme and drastic measures at the beginning of this.
I have a question about numbers. The 1,300 total number number, for lack of a better term, does that include recoveries and deaths from the virus?
Yes. Repeat the question is, does the confirmed case number include those who have recovered? Correct. So you don't subtract out the recovered from the confirmed cases.
Great, thank you.
Do you have any information about the number of tests being done at the University of Illinois Rockford site or Auburn High School? Have daily tests been on the increase or decline?
They're approximately the same, and when we look at that, we do trend it over time. Today, it was closed due to inclement weather, so today would not be a day that you would look at, but they've been averaging over 200 tests per day at both locations.
Any other questions?
Mayor,
I have a
comment on
question
fractures,
for
Hold on.
James,
County
one
Board
second.
Chairman Haney.
All right.
James, hold on 1 second. We got a question in the room. Go ahead.
I was just going to say, you were talking about the
Yes.
fractures in the unified front against COVID-19. Can you be more specific about what you're referring to? Because this week, I think some of the city council members were talking about maybe a resolution pushing for a faster opening. Is that what you were talking about? Or what were you referring to when you were talking about that fracturing of the front?
So the question I was asked is, I mentioned the fractures that are existing or beginning to appear in our community as it regards the debate of what are those next steps moving forward. I didn't quite honestly, Jeff, have any one specific item. I think the benefit of my position and also once in a while the difficulty of my position is I get all of the information from all over the city. So I just said, I think number one, when you speak to as many people as we do in our office, when you're as engaged in seeing things out on social media and in print, I'm not the brightest guy in the world, but it doesn't take a rocket scientist to see that this feeling is becoming more palpable across our community, and the divisions and fissures are just taking place. We've seen it at the national stage. We've seen it certainly at the state level, and we're kidding ourselves if we're not seeing it here at the local level. But I'm not thinking of anything.
But you don't necessarily disagree. You'd like to see some openings faster, too. I think you made that clear.
So the question is, do I disagree with what?
You're both pushing for more of a reopening of the economy.
So the question, in what?
At a faster pace.
Okay. So the question came in as, do I disagree with opening the economy at a faster pace? I don't. I think we should open. The question, though, that it's not A or B. It's in the middle. Because to do this right, you have to balance the health concerns that are incredibly real, regardless of what some will tell you. They're incredibly real to employers, to their employees, to their customers. But you also have to balance the very real factors of the economy. And I think what we've been trying to do through our decisions are, with the information that we have at hand, trying to make the best decisions that we possibly can for all folks. And we look at things in a couple of lenses, and it's someone's physical health, someone's mental health, and someone's financial health. And there's a balance there that, quite honestly, isn't as simple as a 120-character tweet or someone's diatribe on Facebook.
I'll follow that up if that's okay. Thank you, Mayor. The question about polarization around this very tough topic, where do you see discussions falling, sometimes along Democrat or Republican lines, sometimes along folks who are struggling with certain freedoms or being cooped up? They don't like government telling them they can't do something that normally for the last 100 years they could. You see debate around the best way forward. You see people mischaracterizing the intentions of people that are just trying to work through this. I have seen awful things said about people who are very concerned about the community's public health. I've also seen people and their intentions that have very serious financial concerns for themselves and others, labeled or mislabeled as being indifferent to the lives of Winnebago County residents. Somebody like the mayor who is pretty available to the public is active on social media, so he sees things that a governor, quite frankly, wouldn't see or a president wouldn't see. And so that he sees it firsthand. It's unfortunate, it's noise in the environment. I think to your former question about hotspot, that came to a question to the governor when he was responding to being sued over a disagreement on how to best go forward by a state legislator. He said, well, maybe not because Winnebago County is a hotspot. That's not the term I would have used respectfully. What I look at is what Dr. Martell has set up. When you look at our metrics, we're on track. Because of the hard work, we're on track. Our hospital capacity is stable because we have flattened the curve. Our percentage of positive, Dr. Martell talks about this, is very important, has been stable under 20%, which is a major metric to moving to phase 3. All this stuff ties together. Is there a lot of noise in the environment and the fact this is an election season? Absolutely. Is that unfortunate? Of course. But I do think at the end of the day, facts matter. And you see public health people trying to balance impossible things. At the same time, you see business folks trying to manage possible things. The noise is a distraction. I think that's what the mayor adequately referenced. There was a question on the audio here. James?
Yes, Chairman, I got a question for you. With the recent developments that happened yesterday in Wisconsin, the Supreme Court striking down the governor's safer at home order there, what's not to stop people from Winnebago County crossing into, they can't cross into Rock County because they have their own stay-at-home order, but into Greene County and et cetera, to get a haircut, a meal, or whatnot? Are you worried that those people potentially would lead to more cases here in Winnebago County that is closed in a stay-at-home order?
So let me say this, and I think I speak for both Dr. Martell and Mayor McNamara on this, is, you know, we had a conference call today with our area mayors, and the question is about what's going on in Wisconsin related to the striking down of the governor's stay-at-home order. You know, you are seeing discussions about executive orders and executive authority questioned and challenged legally. So in the middle of all the things that Mr. Kolke just referenced about polarization, difference of opinion, you have legal discussions popping up, right? Not new and almost expected because all of this is a once in 100-year occurrence. You know, here's the great thing that I see is that, you know, Mayor McNamara called together a lot of the mayors today in our community, and we're talking about how to thoughtfully do this. And I heard mayors in our community, not just one mayor, but a host of them, really working together collaboratively to balance public health realities with financial realities. And I think that is why, at the end of the day, we're going to go forward in a positive direction together. But is it concerning there's all the legal challenges going on now? Yes. Am I happy that the Illinois General Assembly finally is going back to be in session? Yes. I think that's great. That probably avoids more legal discussions from happening. But in terms of Wisconsin, that is one of, 4 or 5 states around Illinois that the governor and others have partnered with about reopening. They are struggling as well as we are with finding the best approach at the best time, being mindful of the safety of our citizens. Any other questions?
Yes. Chairman, do you see us on track to move to phase 3 at the end of May?
Yes. The question is, are we on track to move to phase 3? Today, based on all of the metrics that has been laid out by IDPH at the state level, the Winnebago County Health Department, based on the public health metrics that are required to go to phase 3. Unless something would drastically change, we are on track. I believe Dr. Martell made it's an on track, off track. I heard a very specific comment. We're on track. That's positive. So when you hear other things, we are on track. But that, to me, is a call to arms for citizens to stay the course, adhere to social distancing. I want in 2 weeks we move to phase 3. Everybody wants that. Nobody is against having more ability to move about in the community, have more things opened up. Nobody is anti that. we're on track, but we're not out of the woods yet. We all have work to do the next couple weeks.
And one more question for you, or Mayor McNamara.
Yep.
Looking at this from an economic perspective, what do you say kind of to those business owners who are struggling and those people who are still continuing to get laid off or furloughed?
I've heard the question is around, what do you say to folks who are struggling financially? I touched on at the beginning of my remarks. Others, the mayor and Dr. Martell have talked about the financial impact on our citizens. It is real. It is disproportionate at times. Not everybody's been impacted on the health side equally. We've seen and talked about that, but not everybody's been impacted on the financial side. We have heard extremely difficult stories about business owners that are struggling to hang on a few more months for us to get to the point we all want to be is more opened up. It weighs heavily. The stories are as troubling as the public health stories that we hear. That is why we continue to show up, and we have having economic discussions balanced with public health discussions. The smartest economic people in our country at the highest levels say, you want to solve the economic challenge, solve the public health challenge in a thoughtful way. You cannot divorce the two and ignore one to get to the other, as much as we all want to.
Your question was, what do we say to the business owners who have had to close their doors during this time?
Yes, and those who are unemployed or being furloughed.
And those.
Struggling financially as well.
So just being honest with you, and the question is, what do I say to those individuals who own a business and have had to close their doors due to the response to COVID and the virus, and what do I say to those individuals who are on unemployment? Just being transparent with you, I don't think any single thing I say or anyone else says is going to make any of them feel better. I guess what I can do from my position, understand neither the chairman or I wrote the executive order or the current state plan, is do all that we can to help support them from a business standpoint and from a personal standpoint. And I guess I'll take the personal standpoint first. I had the opportunity to go to Cornucopia Food Pantry this week. And one of the things that was stated to me when I'm inquiring about how is it going is, our former clients are still our clients, but we're seeing a tremendous amount of first-time clients. And how the process is set up is that you have to show your ID and say how much help you need. They have a wonderful process set up. But you think of that personal courage of someone individual representing themselves or a family who has to get down to a food pantry for the first time in their lives and go up and show their ID and say, my name's Tom McNamara, I need your help. That's personal courage that I think is really difficult to put words on. My heart goes out to them. So I would say to those individuals, know that your city is standing by you. We have 8 sites set up for food. We are there to support you if you need help paying your utility bills. We are there to support you if you need help paying your rent. We are there to support you if you need help paying your mortgage. I understand none of those are enough. I get that. But we are here for you. For those small business owners, again, courage. They took courage to put their entire lives into their business, something I obviously didn't do. And then to see it taken apart and taken away by nothing that they did. I can't imagine the personal devastation that they would have on their own lives. But there again, we at the city are here to support you. We have created a $2 million emergency relief fund for small businesses. We just recently created a $1.3 million relief fund for micro businesses, sizes 2 through 5 employees. We have deferred nearly every single tax we can think of, from tobacco renewal licenses to liquor license renewals to hotel motel taxes to food and beverage taxes. We want to be here to help support those small business owners. And if those small business owners are trying to navigate the bureaucracy of all the plans that are out there to potentially help them, I'd urge them to email businessfirst@rockfordil.gov so that we can help them navigate that very difficult process.
Any other questions?
I'm going to give one final on that, because I think that that's often, you've heard about kind of the polarization and probably the push and pull. And I think when you see the number of people that are up there working, socially distanced, of course, to understand that your community cares. We want to work every day to protect the health and your business. So as we look at the plans, there's so many people that have stepped forward and said, I have a plan. Here's how I think I can meet those ways to help people come back safely into my environment, how I can protect the workforce, and how I can partner with you. And I think that that's where it gives, hope that we are going to move through this. We know that it will be different, and we know that we're going to have to work much more in partnership. I know that I've said many of my businesses on one of the calls with Radek was, you're now a sentinel site for reporting with me. And I know you probably didn't want to get into the healthcare business, but you're now part of the healthcare, industry, as we'll say it. You're going to be monitoring your environment, making sure that your employees feel safe, that if anyone is sick, making sure you promptly identify. Because we really are. It's going to take a community, and this is a pandemic impacts a community, and it's going to take a community to come back. And yes, we're going to be stepping it. I know we're all going to be very excited when some services, our favorite one, opens or not, but we've got to make sure that our child care and some of our summer programs for youth, we've got to begin that process of making sure that people have a place for their children to go so they can return to their businesses. We need to make sure that there's adequate PPE, that people understand the new rules. So even if Wisconsin's open, should you go to Wisconsin? Even if you can, I want to ask you, should you? Should you expose your community that's worked so hard? To understand that we've had outbreaks with our essential workers. But I want to come back to the statement, whether it's the county, the city government, and I know the staff at the health department, the medical reserve corps, the people who are giving of their time, we care. And we are doing everything we can to bring us back out into our next phase safely, sustainably, and with confidence that we don't have to step back. So, there's nothing I can say to individuals. It's very difficult. We all take those calls. We all receive them. And my heart goes out to every individual, as it does to every individual who's been impacted by a death in their family, or a loved one who's sequestered, or someone who's frightened in one of our congregate settings. But at the end of the day, we are a community that cares, and we will get through this. We will not be running a marathon that's fast-paced. We will have to look at the long goal ahead of us. Thank you.
Any other questions? Okay, thank you very much.
What's that back? Oh, great, thank you so much. Okay, thanks. That's my Calvin. Mayor, can I get one minute?
I know, she's like over there.
Doing a dance?
It's their activity for days. I'm like, oh, look at the dancing that's going. And then I have the guy adjusting his mask in the mirror over there. I was like, oh, that's cool.
It is funny to look at the people walking by.